Welcome to the Black Trust Podcast.
It is my belief that we in medicine need to speak more on how to keep people healthy, and we need to promote good health. If we start promoting good health, and there's more talk about promoting good health, and I'm talking about good diet, good physical activity, not smoking, avoiding polluted environments. When we're talking about breast cancer in women, one of the great preventatives in breast cancer is actually breastfeeding, promoting healthy habits. I think people will actually listen to us and give us a little bit more credibility when we talk about things that are more difficult. Prevention in terms of COVID and COVID vaccine, getting screening when it's appropriate for breast cancer or colon cancer, or not getting screening when we say this is a waste of resources. I think that people will get more engaged in the system of healthcare for their treatment. And it all goes back to we need to start promoting good health, and we need to demonstrate to the community that we are, one, truthful, and two, interested in their welfare.
How does the system promote or hinder a doctor taking that tact? Are doctors, are students and interns and residents trained to be thinking about wellness, about lifestyle, about what people can do to take care of themselves, or does the system force doctors to talk only about symptoms and only look at that?
Well, our system in the United States is overwhelmingly, our system of education is overwhelmingly, the emphasis is on treatment. The emphasis on screening, diagnosis, and treatment. There's less emphasis on keeping people well. There's some, but there's less emphasis on how to keep people well.
Is it getting stronger? Is it increasing the amount of time spent teaching young med students to look at that, or is the doctor and the student have to take that on himself?
I think rather than saying it's increasing the amount of time spent on teaching prevention, it's increasing the amount of time spent in people actually learning how to learn. What we so frequently see is people who are repeating what they have heard and not questioning whether what they have heard is correct or not. I see this a lot in the screening world with prostate cancer. Pardon me. So frequently, I hear that men should be screened for prostate cancer. Then I go look at the actual literature, and almost all the respected organizations say not men should be screened for prostate cancer, but men should have a conversation with their physician, learn the pros, learn the cons, and the physician and patient need to come to a decision as to whether that particular patient should be screened for prostate cancer. And so people take the easy way out, and they always want to take, a couple of words and do something really simple, like say, go do this. And unfortunately, this is not have a conversation and think about what is right for you.
Learning how to learn. That is massive. Literally everything in our society today tells us to do the opposite, as you said. Take 140 characters, take what somebody said without verifying it. Critical thinking literally is eschewed at this point. You're talking about shifting a mindset that can be done in Black community networks. That is something, in my estimation, offer your thoughts, that
Yeah,
can be done in community organizing.
I like your phrase critical thinking. Questioning is, I think, important. To question things is not to be impolite. Um, to question things is to actually show interest in what people are saying. I I like it when people actually go to the actual literature on which these recommendations are made. And I spend a great deal of time talking about fruit and vegetable intake, talking about exercise, talking about prevention, talking about populations that do those sorts of things, having less cardiovascular disease, less diabetes, less cancer. Uh, I love it when people say, can you show me some of those studies that have demonstrated that?
Mm.
When we talk about breast cancer screening, lung cancer screening, cervical cancer screening, colon cancer screening, prostate cancer screening, I love it when people ask, can you show me some of the original studies? Or in the case of screening, it's actually wonderful. The U.S. Preventive Services Task Force, which is a government agency that for now we can still trust, the American Cancer Society, which again is a private entity that I think we can still trust. Um, the various medical societies, be it uh, in pediatric in pediatric vaccination, the American College of Pediatrics, in prostate cancer, the American Urological Association. They have published some statements, which I think if people sit down and just look at the statements, and they actually write a version of this for lay people, I think they will come away from uh, with a much better understanding. And it's easier to trust medicine and medicine men and women if you understand what the medicine men and women are actually reading, or at least should be reading. And I
Yes.
say should be reading because occasionally, more often than occasionally, unfortunately, I do hear some doctors who are saying things, and if challenged, they can't really back it up.
That's scary. That's a frightening thing. That's a frightening thing. I'd like to pull a big thread from what you just said in terms of talking to patients about what the comorbidities that predispose or worsen outcomes for prostate cancer, um, and just lifestyle recommendations in general,
Mhm.
diet, exercise, that kind of thing. Again, we're thinking about the Black community here. In organizing in the Black community, it's very challenging to go swim upstream against the tide of intergenerational eating patterns, for example, that include the worst kind of artery clogging
Mhm.
carbs that are part of every family reunion, every Sunday dinner, every barbecue. The carcinogens of meat or food on a barbecue grill is toxic for the body, but nobody thinks this every weekend as to go for the barbecue. We're talking about cultural shift that is intergenerational and deep.
Mhm.
Any thoughts on that?
Well, yeah, I talk a great deal about what's called the built environment, and that is the environment that we are living in. For example, in Baltimore, where I practice, we have a lot of mom and pop grocery stores. In the Black community, there are very, very few grocery stores that carry fruits and vegetables. The logistics of handling food is they don't want food that's going to spoil, so that means canned goods and preserved foods, the very things that are bad for people to eat. It also drives a lot of people into the inner city toward fast food. There we have quite a few people who live in the inner city who eat 3 to 5 meals per week in fast food restaurants.
Yes.
Um, this moves us away. In the ideal world, we should all be eating 5 to 9 servings of fruits and vegetables per week. We should decrease the amount of processed foods to a minimum. If you eat meat, it should be fresh meat. If you eat animal protein, it should be a goodly amount of fish. Uh, Unfortunately, the environment that many of us, especially poor people, especially Black people in the United States, live in, is not conducive to these healthier things. And indeed, I do a lot of comparisons of various countries. Why is it that Costa Rica has a life expectancy 2 years greater than the United States? Why is it that the cancer death rate in Costa Rica is almost half what it is in the United States? It's the avoidance of smoking and its consumption of fruits and vegetables.
Yeah, yeah, and also Costa Rica has an inordinate number of super centenarians relative to the rest of the world as well.
Well, we're talking about why they have a
Yes,
lot of people
absolutely.
who are a lot of old super centenarians is older people in my
Really
world.
old.
we it's not that they have this first class healthcare system which is the greatest at doing cardiac bypass surgery or the greatest at screening for breast cancer and colon cancer. It's that they have fed their population fruits and vegetables and they don't smoke and they exercise and they don't have obesity. One of the things that is really killing us in the United States, Black people more than white, but also white people, is real statistic. In the United States in 1970, 15% of adults were obese. Today, it's over 60%.
Abysmal.
Uh, in 1970, 4% of our kids were obese. Now it's over 20%. And it's worse for the Black community than the white community, but it's bad for the white community.
Sure. As an herbalist and as an environmentalist, my mind immediately goes when I hear you say this to community gardens, growing greens on your terrace, container gardening outside of the window of your apartment. Um, it's been a while since I've plugged into that movement, but those are options. People are doing rooftop gardens. So in core cities, there are options, but people have to be aware that these networks of people that are thinking are trying to counter exactly the fast food canned good kinds of thing you're talking about. There are ways, but again, it takes organizing, it takes communication, and it takes people knowing what to do.
That's absolutely correct. That's absolutely correct. We need health advocates in every community. And a health advocate is someone who's actually trying to make sure that we have the availability of those good fruits and vegetables, that we have an environment where people can get exercise. Just walking around the block a couple of times every day is actually quite beneficial when it comes to promoting health. Yet we have a large number of couch potatoes in the Black community.
Would a doctor in Baltimore, how prevalent do you think this is given your knowledge of where you practice right now? Do doctors in Baltimore say there's a community garden 2 blocks down where you can pick up produce? There's a YMCA or Boys and Girls Club that is talking about how you do container gardening so you can have lettuce and greens growing
Mm.
literally in your kitchen window or medicinal herbs in your kitchen window and container gardens gardening with lettuce and vegetables literally on your terrace. How likely is that in Baltimore where you practice that a doctor is saying that?
It's not very likely at all to happen. Unfortunately, the medical world, the economics of healthcare are such that doctors very frequently don't have much time to talk with each patient. The whole thing is move them in, move them out, get people into the room, address their problem, and then get them out so you can get the next patient in. Occasionally in pediatrics, we do see some well child visits and health promotion. And that's the one place where people actually come. How can I keep my child healthy? And these things can perhaps be discussed. But in the adult world, keep in mind most adults who are age 20 to say 50 or 60 don't really see their doctor very much. And the time to actually start talking about promoting health in one's 60s and 70s is when the patient is 3 years old, quite honestly.
I automatically try and think of solutions and solutions that are community based and very low tech, easy to put into place. If a doctor has a pamphlet to hand someone because they only have 15 minutes with that patient about some drug or some treatment, would it be possible to have a pamphlet from the community garden down the street in the doctor's office? It's no more time than it takes to hand them a pamphlet on the condition.
Yeah, I think that is doable. And the other thing is I've tried to get this more into health fairs. I've tried to get our county health commissioners interested in this sort of thing. I've tried to get schools to promote this, take this home to mom and dad. These are the sorts of things. Some of this health promotion need not be done in the doctor's office per se. Trying to get it, this is one of the things that we're doing at Hopkins, trying to get it more into the community, more a focus on health promotion from the community. It's sort of interesting. We see some health promotion with regard to screening coming out of the community. And I've actually been concerned that sometimes that message that I hear is wrong. We have not seen this health promotion message with regard to how to prevent disease.
It would really be interesting to meld the medical healing environment with information that is really practical about how you get to the food that you're recommending, you
Hmm.
know? Um, because people listen to the physician, and also neurologically it makes the connection in your in the neural networks to my type 2 diabetes or my pre-diabetic condition can be addressed by this community garden down the street. So the doctor's talking about lifestyle situations for diabetes, it links it in the patient's mind to the solution
Hmm.
around the corner.
Yeah.